Hi, my name is Alexis Fitzpatrick, and I would like to share with you an issue that is very close to my heart, and I hope once I'm done, close to yours as well. We need everyone to help make these changes happen. When Stephen Fitzpatrick was 9 years old, 7 kids set him on fire outside his apartment complex in Cuyahoga Falls, Ohio. When he caught on fire, he was enveloped. His mind went into shock and he began to run. 2 parking lots away, a man saw something on fire and looked closer to investigate. When he realized that it was in fact a person on fire, he ran the length of the 2 parking lots, grabbed Stephen, and put him out. Stephen was taken to the burn center at Akron Children's Hospital. He was burned on 73% of his body. For the next 2 weeks of his life, he was given only 24 hours at a time to live. He spent 4 months at the burn center recuperating from the third-degree full tissue burns. The hospital grew 44 squares of skin for him. At one point during the process of all the grafts needed, he was considered 100% skinless. Stephen was in a drug-induced coma for 2 of the 4 months to allow all of the grafts to heal properly. Patients like Stephen should not be treated like those that have not lived through a horrific event such as this. When seeking medical care, there are standards of service that patients expect from their healthcare providers, including the proper training to meet those standards. The standards for quality of care should apply to all patients, including patients who have ongoing medical conditions. Ongoing conditions are never in a remissive or stasis state and require the standards to be altered to treat current conditions effectively. While there are many ongoing conditions that allow for the alteration of treatment, burn victims with grafted skin are not in this category. These patients are forced to follow courses of treatment that were put into place without allowances for differential properties of grafted skin or their heightened tolerance to pain medication. This is due to lack of existing precedent and sufficient training. When treating burn victims with grafted skin, medical personnel need to be aware of these significant variances. Unfortunately, there is not sufficient action being taken to rectify this issue. Funds need to be raised to facilitate additional training for healthcare providers across the board, outlining alternate courses of treatment for patients with skin grafts that allow them to consider the patient's differing reactions to treatments and medication, including improved guidelines for prescribing pain medication. Also, petitions need to be gathered, advocating that the patients themselves be given a digital copy of their complete medical history, allowing them to present their current doctor with the information needed to treat them more effectively. When physicians treat a victim that has skin grafts, the difference between grafted skin and normal skin must be fully understood. Grafted skin is not like normal skin in that it does not grow and stretch with the patient. Stephen Fitzpatrick has explained that he has had to undergo several additional surgeries to graft additional skin to sites in his body to accommodate his growing and to permit full mobility. Grafted skin can also react differently to incisions and topical ointments that are normally used in various treatments, and these reactions can change as frequently as every month. And here I have some photos of Stephen's grafted skin. This is, sorry about that, his arm where he has had additional grafts added to permit full mobility. And then this next photo that I would like to show you is of his chest and arm where it is all grafted skin. And you can see the difference here. He actually does not have nipples. Those had to be tattooed back on due to the burns that he sustained. The first part of this problem with treating the grafted skin is that medical personnel need additional training to teach them how to care for grafted skin after it has been healed, as I just showed you in the pictures. In addition to the grafted skin lacking the ability to stretch, it can also change in sensitivity, color, and texture in a matter of months. When a surgeon makes an incision in healthy skin, they can predict with a great deal of certainty how the healthy skin will react when cut. This is not the case with grafted skin. A good analogy to envision what will occur when the grafted skin is cut is to picture what happens when you hold a cotton bed sheet tightly between two hands and then make a cut down the middle. The result will be that the sheet will split much further down than the actual cut that you have made. And that is due to how tightly you're holding both sides of the sheet in place. And so that's a good analogy for what happens with grafted skin when it is cut. Another property of the grafted skin is that it is very sensitive to topical ointments as well. With the grafted skin considered to be an ongoing medical condition, its sensitivity can vary from month to month. Acta Dermatovenerologica tells us that split thickness skin grafts and full thickness create a deficiency in the skin which can take years to heal. The secondary issue is that the healthcare provider needs to keep in mind that the patient has had to undergo many painful procedures that warranted high doses of pain medication. This causes the patient to have a heightened tolerance to pain medication than that of a normal individual. Physicians need to keep this in mind when prescribing pain medication for these patients. The doses that are normally given will most likely not be effective for a person who has been given such high doses in the past. Without being able to view a patient's medical history in its entirety, physicians often make the wrong judgment call when treating them. For instance, say you have a 34-year-old male that comes into the emergency room who suspects he has shingles. The diagnosis becomes harder to make due to the fact that the physician does not have access to the patient's full medical history and the patient has skin grafts. So the physician has no frame of reference as to what the patient's grafted skin looks like when there is no irritation present. Stephen Fitzpatrick tells us that it is very frustrating as a patient to feel like you have a better understanding of your body than the doctor treating you does. Without complete medical records on hand, the patient is required to fill in the blanks. And this is not always an easy task because some physicians may feel like the patient is exaggerating or does not know their body or the current state of their grafted skin as well as they say they do. The patients should be given a complete digital copy of their medical history so that they will have it on hand for their current physician to refer to. Petitions should be signed to ensure that this will happen. Advances in Skin and Wound Care describes the damage to the skin, saying, a full-thickness burn destroys the first two layers of skin, and therefore the ability of the skin in that location to regenerate. Therefore, the long-term care for victims should be altered as well due to the trauma that their body has been through. Medical personnel are given the minimum amount of training required to pass their exams, but unless they work in a burn unit or perform reconstructive plastic surgery, they lack the training to properly care for a patient with this type of condition effectively. There are only 2 burn centers in the United States that treat victims of all ages, not just children. One is located in Akron, Ohio, in the Akron Children's Hospital. It is the Paul and Carol David Foundation Burn Institute. They care for the burn victims during the recovery, host monthly support groups for survivors, and make educational materials on fire safety. One of the community resource trainers would be the perfect candidate to help with the additional training that the other physicians need. The CEOs of insurance companies believe that patients that have skin grafts should have to follow the same course of treatment as those that have not been burned. The basis for this thinking is the goal to ensure that everyone receives the same standard of care. The World Health Organization says that, formalized in 1948, the Universal Declaration of Human Rights recognizes the inherent dignity and the equal and unalienable rights of all members of the human family. They would argue that to ensure that all patients receive the same standard of care, that all patients should undergo the same courses of treatment. This statement is not true for all patients due to the fact that if the patient has suffered third-degree full thickness or split thickness burns and have had to have grafted skin, they need to be treated differently. So by treating them the same, they are actually ensuring that they will not get the standard of care that the organization is striving so hard to provide. This problem can begin to be solved by signing petitions to urge these companies to change their courses of treatment for this particular group of patients. Solving this problem is a many-faceted undertaking. Funds need to be raised to facilitate the mandatory seminars for healthcare professionals, which will be presented by a highly trained individual who has firsthand experience treating patients with skin grafts. The seminars will cover treating them for present ailments and prescribing appropriate pain medications as well. Raising the funds will make it possible for the physicians to obtain this information without any out-of-pocket costs, therefore providing assurances that all healthcare providers will receive the training. In addition, petitions need to be compiled supporting the compilation and release of the victim's complete medical history to a portable digital device that the patient can keep with them to present to their current healthcare providers. This will allow the patient's current physicians to have immediate access to their medical files so that they will be able to modify and prescribe the best course of treatment that functions around the patient's history. This will also permit the healthcare provider to see how effective certain courses of treatment have been for the patient in the past, including their heightened tolerance to pain medications. Implementation of all these elements should ensure that the burn victim receives care that treats their current complaints in the most effective manner the first time. For more information, to sign a petition, or for more information on how to make a donation, you can visit our website, which is http://helpthescarsfade.weebly.com. And again, that's HELPTHESCARSFADE.WEEBLY.com. Thank you for your support.